Let's take a few minutes to think about the characteristics of humane euthanasia agents as well as their mechanisms of action. First of all, we know that euthanasia literally means a good death, and that means a death with minimum pain and a minimum of distress. It's not why they die, but how they die, and euthanasia decisions will be the responsibility of every shelter, regardless of their mission. In some cases, euthanasia will be the kindest decision to be made for an individual animal. So, what would the characteristics of an ideal euthanasia agent be? I think that there are numerous things to consider, and as we think about these, it's important to do so in the context where you will be utilizing them. So we'll think about this in the shelter setting, but we'll also talk about mechanisms relevant to agents that may be used in other settings as well. But regardless, we want them to satisfy several criteria. First and foremost, euthanasia agents should not cause anxiety, alarm, fear, struggle, or vocalization. And of course, the restraint method, the surrounding environment, the technical proficiency of the staff performing these procedures is key to that. In addition to the agent itself, it's all of those other things surrounding the process of euthanasia. Next, pain-free. This needs to be as painless as possible. Certainly needs to be fast-acting in general. We want a very rapid death, at least a very rapid loss of consciousness would be ideal. It also needs to be something that's highly reliable. It needs to work every time. Every time we use it, it needs to produce a very similar, if not the same, result. It needs to be safe for those that are administering the agent. And it needs to be relatively easy to administer. If we properly train personnel to administer it, we need to be able to assure that they can become proficient without too much effort. Hopefully, the agent will not be a substance of abuse. If it is known to be a drug of abuse in humans, then of course we have to keep it under strict control according to federal regulations and any other state regulations that exist. Aesthetics are also important. It should be aesthetically acceptable to use, and that goes to the emotional effects on the personnel that have to administer it, making aesthetics very important. Also has to be practical and feasible, something that we can accomplish in the given setting. And economics always play a role. It has to be economically feasible as well. Next, it should not create environmental contamination that could be harmful. And finally, ideally, it should not complicate necropsy. In other words, we don't want to have tissue residues that will interfere with laboratory testing, and that's especially important in some particular individual cases. The AVMA panel on euthanasia considers the ability of various euthanizing agents to meet criteria such as these, and based on their evaluation of that, they then classify agents as either acceptable, unacceptable, or somewhere in between. I think thinking about that list, it hits us that really there is nothing that is the ideal agent. Nothing can truly 100% fulfill all of those criteria. But that being said, barbiturates absolutely come closer than any other agent to meeting those criteria, specifically sodium pentobarbital. And that's because through direct neuronal depression, it causes a rapid loss of consciousness first. That's through direct depression of the cerebral cortex. Without that functioning, we cannot experience pain. And then the overdosage of sodium pentobarbital will cause death by depression of the vital medullary respiratory center, followed by cardiac arrest. One thing that it's important to note, and the AVMA's panel on euthanasia spells this out in their document. They describe that depending on the speed of onset of sodium pentobarbital or any agent used, some animals may experience a release of inhibition of motor activity, and we may see things such as muscle contraction or vocalization, and that can be, of course, very distressing to the observers. But if those actions are occurring after an animal loses their righting reflex, in other words, we're seeing subsequent motor activity or vocalization or reflex struggling after they lose their righting reflex, then by definition that animal has already lost consciousness. So they're not perceiving that, and according to the panel on euthanasia, those actions are not purposeful. Other mechanisms for rendering the cerebral context non-functional include hypoxia. Hypoxia, of course, is commonly achieved when animals are exposed to high concentrations of gases that displace oxygen, like carbon monoxide, carbon dioxide, things of that nature. And then finally, the last mechanism for rendering that cerebral cortex non-functional would be physical disruption of brain activity through things such as electric shock, concussion, in other words, a direct blow to the skull, or direct destruction of the brain through something like pithing or captive bolt. So in summary, what we're looking for is for that cerebral cortex to become non-functional as quickly as possible so that pain cannot be perceived. Any euthanasia method has to accomplish that, whether by neuronal depression, hypoxia, or physical disruption. The way we handle that animal, our technical proficiency, the euthanasia environment, all of those influence the success or failure of an agent to produce a good death.